Next, we're going to talk about direct-acting skeletal muscle relaxants, and dantrolene is the drug that we're going to discuss here. Dantrolene exerts direct muscle relaxation. It inhibits the release of calcium, thus making the muscle less responsive to nerve impulses. Dantrolene is primarily used for the treatment of MS, CP, spinal cord injuries, stroke, and malignant hyperthermia syndrome. Dantrolene can cause muscle weakness that interferes with functional improvement and the participation in PT. Some of the adverse effects of dantrolene are dizziness, drowsiness, malaise, fatigue, GI issues, and photosensitivity. It does have a black box warning for hepatotoxicity and overt hepatitis, so frequent monitoring of the AST and ALT labs have to be done. It should be DC'd if there is no observed benefit within 45 days of beginning drug therapy. Safe nursing practice for dantrolene includes providing a safe environment to prevent the risk of falls, avoiding exposure to sunlight, and if sunlight is necessary, to wear sunscreen, to assess for personal and family history of malignant hypothermia if scheduled for anesthesia. Skeletal muscle stimulants are drugs that stimulate the skeletal muscle action. They're primarily used for the treatment of myasthenia gravis, which is an autoimmune disorder characterized by weakness of skeletal muscle and fatigue on exertion. It affects men and women equally, usually with the mean age for women being 28 years and for men being 42 years. The classic appearance of myasthenia gravis is the drooping eyelids, the difficulty swallowing, and inability to perform even the simplest of tasks. Treatment with anticholinesterase inhibitors, with the most popular being pyridostigmine bromide. It's better tolerated than the other drugs, and the preferred route is oral, and that is pyridostigmine bromide. It has an immediate acting with an onset of 30 to 60 minutes and a duration of 3 to 6 hours. Safe nursing practice associated with pyridostigmine is assess the ability to swallow, test muscle strength, and assess for ptosis of the eyes, and that's PTOSIS. Ensure that the medication is received early in the morning before eating or any self-care activities. You should plan your physical activities shortly after medication administration. Clients should be instructed for home use to carry a medication information sheet with them, and that they should understand the importance of drug compliance. Medications must be taken at the exact prescribed time, and atropine sulfate is the drug of choice for an anticholinergic crisis. RLS is the next disease process that we're going to discuss. It is a neurological disorder characterized by uncontrollable urges to move the legs. It's usually accompanied by marked discomfort or pain. It may affect one or both legs. It is triggered by rest and inactivity, and other symptoms include burning, creeping, tugging, and crawling. It may be primary or idiopathic in origin. It may be secondary due to pregnancy, iron deficiency anemia, or end-stage renal disease. There is no cure for RLS. Non-pharmacologic treatments include avoiding caffeine and alcohol, and avoiding nicotine and stress if possible. Metoclopramide and certain calcium channel blockers should be avoided in RLS patients. One of the drugs of choice for RLS is gabapentin. It is an anticonvulsant that has analgesic properties. It does have adverse effects, which include dizziness, somnolence, ataxia, fatigue, nystagmus, and headache. Some clients may also experience GI issues. Gabapentin should be taken 2 hours after antacids because antacids decrease the bioavailability of the drug. Cimetidine, morphine, hydrocodone, and naproxen increase its effects. The next drug for RLS is Requip. It's the newest dopamine receptor agonist. It has fewer side effects, which include GI issues, compulsive behaviors, headache, and chest pain. Requip should not be taken with any alcohol or other CNS depressants. At this time, we are not going to discuss osteoporosis, because when we talk about musculoskeletal disorders, we will discuss osteoporosis at that time. So you do not need to be aware of any of the other drugs in the osteoporosis section. So just the things that I have covered in these lectures. Okay? And that is it for this one.